All right, so for my presentation, I will mainly focus on a particular chapter of the book that looks at workers' compensation regimes and processes across the four provinces we looked at, which were Alberta, Ontario, Quebec, and Newfoundland and Labrador. So I will, of course, look at the challenges that are faced by interjurisdictional mobile workers, mainly. So for this chapter, we drew on findings from Workers' Compensation Acts, policies, on case law from the different compensation appeals tribunal dealing with claims from different type of mobile workers. And we looked at studies that were conducted, such as your study, Robert. So when we look at workers' compensation regimes, I think we have discussed this a lot in the past day and a half. We're looking at a really complex regulatory system and also to a process that may prove difficult to navigate for workers in general, but that poses acute challenges for mobile workers due to the work they do and what this work actually entails. And as we've discussed, there are various stages of the compensation process. So I will discuss some of these challenges in each of these processes, from access to compensation to rehabilitation, return to work. So every process starts with trying to access compensation. So if workers are interjurisdictionally mobile, further complexities may arise when it comes to claiming, since they need to navigate the laws and regulation of different jurisdictions. When mobility is across provincial or national boundaries, before a claim is accepted, there is a determination that has to be made as to which WCB should provide coverage for the worker. In some cases, the compensation board will accept the claim, depending on if the worker was working out of the province, so where he was working actually geographically, or where he's from and who is the employer also. But each jurisdiction has specific rules regarding the territorial scope of the law. And in some situation, it's possible that a worker may be deemed ineligible for compensation in the multiple jurisdiction or in a few, but then he has to choose. So this is a layer of complexity that is added. And in order to know which laws and regulation actually applies, you have to look at the definition of the worker, of the employer, the territorial scope of the law, and further exclusion of certain industry that are particular for each provinces. Also, the nature of the injury may have an impact on the capability of workers to access compensation. Of course, in some cases, if it's an acute injury, and we have had examples that it's not always so simple, but for some occupational disease like noise-induced hearing loss that develop over time, or other types of cancer, for example, that have long latency period, in these cases, exposure may have occurred decades before the symptoms and in more than one jurisdiction, so this poses additional layers of difficulty. So if and when workers have access to compensation, what happens? Well, different thing will happen, but some workers who don't live in the province where they were injured may wish to heal at home with their family. So what happens in these cases? So in some situation, workers can return home and heal. They also, so before returning home, they also have to have the approval of the Workers' Compensation Board. So this is the first step. And some will not be penalized. And Dalia discussed some international agreements that also will sometimes facilitate this process, but it's not with every countries, it's not in all provinces, so this also is an additional challenge. But in some cases, when workers wish to return home, this will impede full access to benefits, and particularly if the WCB considers that the recovery will be delayed. And also, at one point during the process, And we have discussed this a bit with the financial incentives that employers have to return to work workers early on in the process because it saves them money to do so. Some workers will be eligible or obliged to take up modified work before they reach the maximum medical recovery. And I will discuss these issues because it's pretty much the same for this early return to work or return to work after a rehabilitation process. But in many cases, workers who live far from the job site, they can maybe do the work. They can go back and do the work that modified that is proposed by the employer, but they can't get there because of their injury. And this will not always be taken into consideration by WCBs, by the Workers' Compensation Board. So this also has to be considered. And in some decision that we found, where it was possible for the worker to have access to medical services, the WCB were then more prone to say, yes, you can in fact go back because you can have physiotherapy even though you live far from the workplace. And so return to work after recovery, we've discussed this also. I feel like I'm repeating a lot of stuff, but vocational rehabilitation and return to work is a cornerstone of compensation regimes in order to maintain the ability of workers to work. So we've seen return to work prior to the maximum medical recovery, but once a worker reaches this kind of plateau where he can't get any better, sometimes they can return to the pre-injury jobs, and sometimes they will have a rehabilitation process, and suitable employment will be determined by the WCB. And we've discussed early this morning how in some cases this return to work process is actually, Jill Henley, I think, called this an illusion for some workers, particularly for migrant workers. And so for the mobile workforce, different issues can arise when it comes to returning to the same job or for the rehabilitation and retraining process. And I think Robert's presentation really highlights some of the issues that we have to focus on. But in some cases, like I said, the consequences of the injury will not affect the worker's ability to actually perform the work, but will prevent them to traveling to and from work. And Catherine Lippel and David Walters' previous study had emphasized that some workers who used to be mobile prior to their injury may be presumed to be able to continue to do the mobile work once their injury has healed. But as it was the case for a temporary assignment or modified work, the difficulties associated with travel to and from the original or new work may not be considered. And we have seen a few cases where workers, for example, could not return to work after recovery because their medication prevented them from driving, or the long distance that they had to travel to get to work could exacerbate a back condition, for example. And in Quebec, what the case law mainly says is it's that the choice to live far from the place of employment is considered to be an individual preference. And as such, travel to and from work will not be considered in evaluating the individual's ability to return to pre-injury employment. And in one case, the reasoning of the appeals tribunal in Quebec was that if commuting accidents are not occupational injuries, then traveling to work is not part of the job task, so it won't be considered. We have seen, however, some policies in Alberta that provide that commuting must be reasonable, and some tribunal decision, for example, considered that they had to take into account whether a worker could take proper driving breaks during the commute due to his condition, or if he could actually maintain this commute on a daily basis. In Ontario, also, commuting capacity of a worker may be taken into consideration when determining if the proposed employment is suitable. In one case, the appeals tribunal had to evaluate whether the commuting asked of the worker in order to find suitable employment was reasonable in light of the functional limitations that had been determined. And I prepared a bit about deeming, but we have talked a lot about that. But workers' compensation will establish the benefits of the basis of deemed loss of earning attributable to the injury. So they will find this wage replacement mechanism. They will calculate the difference between earnings at the time of the injury and wages the worker is capable of earning, not what they actually earn after their injury. So what we have seen, so with this decision that clearly comes and changes the way it impacts mobile workers. So this is for migrant workers. And I just want to come back to this decision so that we spoke about the 4 Jamaican workers. The WSB tried to say that workers had loss of income not as a result of their workplace injury, but because of the global economic disparity between Ontario and descending countries. And this was fortunately rejected by the appeals tribunal. And it's interesting when you look at the decision, because in that decision, the tribunal drew parallel with the situation of interjurisdictional workers, for which in Ontario, actually, they may be taking into consideration workers, the labor market where they live. So even though they worked in Ontario, they may consider that now that a worker lives in Nova Scotia, Newfoundland, they can take into consideration, because also this was mentioned this morning, but the policies of the WSIB are silent on this matter. But in other provinces, generally, if like Newfoundland workers injured in Alberta, they will take into consideration the market in Alberta and the salary in Alberta. So a worker from Newfoundland that has a suitable employment determined in Alberta with the high wages that are in place in Alberta, if he can't no longer fly in, fly out to Fort McMurray, for example, this may lead actually to a deemed earning capacity that is far higher than what he could realistically have in Newfoundland. And workers in some situations will be encouraged to seek employment in Alberta, although in reality, they are more likely to be able to find and hold a job as opposed to a deemed job in their home jurisdiction. So this was a pretty high-speed overview of some of the issues. I'm like, don't have any more, j'ai plus de souffle. So yeah, so we touch on a lot of things in the book in much more details, but these are some of the issues arising from the implementation of the workers' compensation schemes in the context of mobility. And we show in the book how we actually have different regulatory frameworks that coexist and that clearly create gaps for protections for different types of mobile workers. And we highlight the multiple challenges and ambiguities that exist for injured workers when accessing workers' compensation and its benefits in the context of mobility. And Dalia spoke a bit about this, but we also discussed the book, how commuting accidents, we discussed the case of workers who live at work, and we discussed earlier in a previous panel how this clearly creates inadequate protection for international migrant workers and clear gaps in the protections that are in place. So thank you. We actually have, I'm not sure when the session is supposed to end. Like there are two times in the program. One says 4:20 and the other one 4:30. So maybe we could take 5 minutes if somebody has a question. I can pass around a microphone. Yes. Okay.
So, Dalia, this is for you. First off, as a result of a conversation on Sunday, I understand that the federal government has given permission to the Kenyan government to negotiate agreements about temporary foreign workers coming to specific provinces, and that Nova Scotia is one of them. We're looking to try and find where else. But so this is, I mean, if the Kenyan government is doing this, who else is? But so that's point of information. In terms of a question, some years ago, I was doing work with bus drivers, and I don't know whether they came up in your work, but one of the big issues for bus drivers is bathroom access. So I was wondering, who else has to deal with that as a hazard at work?
I'm just going to say one thing about the pilot on truckers. So there's numerous pilots right now under the TFWP, but also under the International Mobility Program. So I really want to stress this with everyone because we often overlook the International Mobility Program, which doesn't require a labor market assessment for employers. But there's a lot of pilots there, a number of pilots that you cannot imagine. I went through them last week for a presentation, and there's a lot of sectors that are not, like we could think, very high-skilled workers that go through the IMP. So I'm just saying this because it's also a new thing that's going on, that's been going on for a year now. So I don't know if that pilot is through the TFWP or the IMP, but I know the Maritimes have at least 3 pilots for specific professions in the healthcare sector, also under the IMP, which doesn't require labor market assessment. I just want to say that parenthesis, but I'm going to let Barb answer.
Okay. Yeah. So, and in terms of bathroom access, yeah, I mean, this became so vividly obvious during COVID, right? So, I mean, all of your courier workers, but truck drivers and so on. I mean, they couldn't get access. The restaurants on the roads for truck drivers, they couldn't get access to their rest stops, right? They couldn't, and the courier workers couldn't get access to bathrooms, and yet everybody wanted their meals delivered at home, right? So, I mean, these are fundamental things, but again, one of the things about COVID is it made really visible, right, that how mobility is such a pervasive part of the society, and in order for the rest of us to not be mobile, somebody else had to be doing a hell of a lot of running around. But the regulatory agencies, the public health people and so on were not aware, had not thought through basically all of the issues that these workers were encountering, including fly-in, fly-out workers. It was incredible what they went through in terms of trying to get in and out of to just return home, and they had to go into quarantine and live in their sheds, and then 2 weeks later they had to go back to work, and then they quarantined there, and so on and so forth. It was incredible.
And just maybe to add also for truck drivers during the pandemic, they didn't have any rest stop. So it's clearly an occupational challenge, but yeah, policy doesn't touch us on that. Anybody have another question? Last one. All right, well, thank you. We have a 20-minute break then.